This is the common health behaviors, the most common risk factors for chronic diseases. I don't know if people saw the press. Doug Manuel at ISIS this week released a big study that showed if we did all the 7 things that are good for us, we'd all live 7 years like healthier. And this is, this is the rates of people who are physically inactive, inadequate fruit and vegetable intake, overweight and obesity, and smoking. And the bottom line is that none of us are doing well. So there's a huge, opportunity for health promotion. But we see this is by education, which can influence your health choices. So we see the same gradient. But I want to point this out here in terms of smoking. 28% of women in the province who haven't finished high school and 26% with only a high school education are still smoking, compared to 8% who have some university. So even though Ontario has had a smoke-free strategy, which has been quite successful in reducing overall rates, to get those rates down, we need to start targeting those who are still smoking. So this is a percent of people who report being in low-income households. And the only point here is that it varies a lot by race and ethnicity. And we're increasingly having poverty concentrated, Black, South Asian, Aboriginal, and I think it's something that we need to pay attention to, and especially think about the health consequences as well as the other social consequences. This is also the percent of low-income families that are, the percent of families that are lone parents. And you can see 39% of low-income families are headed by a lone parent. So if you think about what that means in terms of the life course and developing healthy children, that's another important place to target. And this is my last slide on the social determinants of health. But and this is old data. This is from 2005, and it's probably a lot worse now. This is a slide that shows the percent of the population who report food insecurity. And that's basically having a challenge getting either the quality or quantity of food you need. We hear now more about the challenge of the food banks. But at that time, 25% of low-income households were reporting food insecurity. I know I still practice. I see patients at St. Mike's. If I have a diabetic, I can't control their diabetes if they don't have access to healthy food. So it has a huge link into the health system where diet is so key in terms of management for all of the chronic diseases. So we did some back-of-the-envelope calculations, and this is where you business people might get it. But if all Ontarians, so I'm just joking. Some of my best friends are in business. If all Ontarians had the same health as Ontarians with higher income, there'd be over 300,000 fewer people in fair or poor health, to over 200,000 fewer people with disability, and over 3,000 fewer deaths a year. That's a huge, and think about the cost of taking care of all those people. If we were really concerned about health system sustainability, I think this is one really important fact in terms of making the case for focusing on health equity.